What's up, everyone? My name is Gabe, and I'm here to talk about my first experience ever shadowing a physician, and this time specifically a neurosurgeon. For those of you who are new to the channel, my name is Gabe. I am a pre-medical student or a college student, and I started this channel to document my journey from college or pre-med to medical school to residency, and hopefully someday a job as an attending physician. All right, let's talk neurosurgery. My major in college is neuroscience, and from a very young age, I've always been extremely fascinated with the brain. And the specialty that I want to go into once I get to medical school is neuroscience, neurosurgery. It's just my ride or die at the moment, at least. And I was lucky and fortunate enough to shadow a very experienced, well-known, and kind physician, a neurosurgeon. And this time I shadowed him through the clinic. So this time I wasn't in the operating room. For my first time shadowing, I thought I'll start with the clinic. I saw a variety of patients with different pathologies, and I'm going to explain what I saw right now. Very interesting, a lot of fun. I really enjoyed myself, and thank you so much, doctor, for the opportunity to shadow you, and I hope to shadow you soon in the OR. I was in the clinic for 2 days where I saw a wide variety of different pathologies, very interesting, very complex. And I'm going to go through some of the pathologies that I saw now. Now, I was given a lot of different pamphlets of the different things that I saw, and I kind of read them all and condensed it into a more pedestrian kind of knowledge base. So maybe you don't know as much about medicine, medical terminology, and I'm hoping you can kind of understand what's going on with these patients through my summary of the conditions. I'm going to go over a lot of different pathologies that I saw while I was shadowing the neurosurgeon in the clinic. One of the main illnesses that I saw, especially among elderly people or patients, is called normal pressure hydrocephalus. You can think of normal pressure hydrocephalus, or NPH for short, as a buildup of fluid on the brain and in the cavities of the brain. And as you can imagine, the more fluid that's built up in the brain, the more pressure is put on the brain. And this pressure can cause various and very debilitating symptoms, including blurry or double vision, nausea, vomiting, headaches, loss of bladder control. And the main one is problems with balance, coordination, speech, and memory. So those are the big symptoms to look out for if you suspect something is wrong with the patient. There is a treatment. The treatment is a surgical implantation of a shunt system. Essentially, the shunt reroutes fluid from the nervous system and the brain to other parts of the body. I'm going to show you a model here. As you can see, the shunt is placed in the brain, and there's a catheter that drains that fluid from the brain all the way down to the abdomen. You can think of the shunt as almost a dam, where the higher the dam, less fluid is drained, and the lower the dam, more fluid is drained from the brain. That dam is controlled by a magnet you can place on the head. It connects to the shunt, and the lower the magnet, the lower the dam, more fluid is drained. The higher the magnet, the higher the dam, less fluid is drained. It's a very interesting condition. I learned a lot about it because I saw so many patients with it, and it is something that I want to learn more about. It's something that he gave me a lot of different pamphlets on it, so I'm going to read them all again and try to learn as much as I can about it. The second most common condition that I saw while I was in clinic is something called a herniated disc. A herniated disc is essentially an injury to the spine or the spinal cord. You have a series of bones called the vertebrae in your spine stretching from the base of your skull to your tailbone. And then there are, between the vertebrae, round cushions called the discs. These discs act as buffers between the bones. They absorb shocks. They allow you to bend and move with ease as well. When one of these discs either tears or bulges, it's called a herniated disc. You can see in this model right here, this disc is sitting properly between the two vertebrae and it's not pinching the nerve. But this disc is bulging out of the vertebrae and is pinching on the nerve. That pinching can cause a lot of pain and irritation. Now, there are two different options for treatment. There are non-surgical and surgical options. Of course, you try to start with non-surgical options because that's less invasive. The non-surgical options include a mix of physical therapy, which the goal of that is to strengthen the muscles behind the bone to push that disc back in, along with pain injections where you inject pain medicine directly on the nerve, and those two together should help with pushing that disc back in and relieving some pain. If that doesn't work, then you perform a procedure to remove that disc. Other than clinic, I also went rounding with the neurosurgeon, where we went to the hospital and we rounded on patients that he had performed procedures on earlier in the week, and we checked to see how patients were doing. It was some really difficult things to see. One patient we had to recommend to the family to withdraw life support. That was something that was very moving to me and very humbling. And I hope I never have to do that. But I saw a lot of different things that I never thought I'd see, but it just motivated me to become a physician even more. It cemented the love that I have for medicine, and this will always be a memorable experience. It's my first ever shadowing. I'll do another video on more of the things that I saw. I just wanted to give you a little bit of a taste of what I saw. And then I'm also going to be shadowing again in the OR, so I'll do another video of that. So a couple more videos coming your way. I really appreciate you sticking around. I hope you enjoyed this video, and I will see you in my next one. Bye.